Throughout my professional journey, I have always prioritized the health and well-being of the patient. So I'd like to share with you experiences that demonstrate the benefits of visualized endometrial sampling over blind curettage or biopsy. In this example, we'll look at a case that demonstrates the benefits of visualized sampling to provide the opportunity to obtain a sufficient and high-quality sample. This patient is a 65-year-old who is on menopause hormone therapy and has persistent postmenopausal bleeding. She had already had a previous endometrial biopsy in the office with her referring provider that showed scant proliferative endometrium. No hyperplasia or malignancy was identified, but because the endometrial sampling was scant, an ultrasound was done which showed a lining of 5 millimeters. So in this case, the patient opted to proceed with a hysteroscopy for additional collection of tissue. Obviously, with her being on menopause hormone therapy and having a lining of above 4 millimeters in the setting of postmenopausal bleeding, the concern was for hyperplasia and malignancy. And what's difficult about doing an endometrial biopsy in the office is that, of course, it's blind, and so we can't know that we haven't missed something like a focal lesion. And we also don't know whether we're getting scant tissue because the patient has atrophy in the setting of menopause or because the sample just truly wasn't sufficient. So this can be a really frustrating scenario for patients when they have a painful procedure in the office, hoping to get some answers, but unfortunately they don't come out with them because the sample ends up being too little tissue in order to be read confidently by pathology and have a diagnosis rendered. So with this, we're doing essentially a DNC, but under direct and continuous visualization with the MyoSure light. So in this case, we can see the whole cavity very clearly. We can see that there aren't any concerning focal lesions. And so we're using the MyoSure light in order to collect the very surface endometrial tissue and make sure that we're sampling from all 4 quadrants of the uterus. So here we know that whatever tissue we're getting is all the tissue there is in the uterus and that we're not leaving any tissue behind. So we know that we're giving the patient a very accurate and thorough diagnosis, and she isn't going to have to come back for any more painful procedures. In summary, I think this is a great case that demonstrates the value of hysteroscopy and visualized sampling to do a traditional DNC procedure because, one, we know we're getting a high quality sample without any artifact, but we also know that we're getting enough tissue for the pathologist to confidently render an accurate diagnosis.